radiologists to look for something, to be very careful and make sure we're not missing something. A lot of women have pain. Bilateral pain is more common and it's more of a benign finding, but when something is focal and doesn't go away, that's a very important sign for you to seek attention, go to your doctor, get a clinical breast exam, and then get the referral to get the imaging done immediately so that you can, be able to exclude a worst case scenario.
Making sure that you know your body is so important, of course.
Very important.
And when I think the key thing here that you're kind of getting at is if something seems a little bit off, it's probably worth getting checked out.
Absolutely, especially during this time. Like a lot of women say, I'd rather be safe. I don't want to go out and get something. But it's very important. A lot of doctors right now are doing telemedicine. So you're able to ask those right questions to your primary care doctor, your OBGYN, and then they can further triage you to see whether you need immediate attention and immediate imaging. And that's very important for people to know that there's more ways to get, further help than just walking into an office. You can actually also be, have conversation with your doctor via, a Zoom, those Google chats, all those different methods that are coming up now.
Yeah, you actually read my mind. I was about to go down that road. If there's someone who really is just having an issue enough, being a little bit scared of COVID, are Zoom meetings available, or are they practical for what this is?
They're practical to have with your primary care doctor and your OBGYN. But once it comes to imaging, of course, you have to step out of your house.
Sure.
But it's very important for women not to have that thing in their mind saying, oh, I have something, I have a change. Is it important enough for me to step out of my home? So I think it's very important for women to know that that option exists, that, having telemedicine, whether it's with your primary care OBGYN or whether it's through an urgent care Zoom conference, it's very important to just know that, your concerns are being heard.
Comfort level, of course, is such an important thing for anybody, and especially if anyone is concerned that they are experiencing breast cancer. When you talk with patients, what's the biggest concern that most people have?
That's a very good question. So there's different levels. So there's first where we find something on imaging and we let them know that they need a biopsy. Of course, at that point, everyone's mind is worst case scenario.
Sure.
So at first, I try to, calm the patient and let them know, we are taking this one step at a time. Right now, we're seeing something abnormal. We don't know a name to this yet. Once we get the pathology back, then we can discuss what happens next. And most patients right now, of course, are concerned with what's going to happen. The COVID is happening right now. A lot of surgeries are being put on hold. A lot of treatments are being put on hold. So a lot of women are saying, why do I want to know right now? I don't want to be immunocompromised during this period, which is a very legitimate concern. Of course, right now we're no longer in March, April. We're more towards mid to late June. So a lot of these surgeries have already started happening again. A lot of women previously in the last month the ones that we did diagnose, started taking hormonal therapy if their cancer was able to react to that. So even though the surgery was not happening immediately, they were able to get additional treatment to prevent the actual mass tumor from growing. So, there's other options besides just surgery and radiation. There's other things that can be done during these times.
Dr. Mariela Heschen, thank you for being with us this morning.
Oh, of course. Thank you so much for having me.
It's Dr. Mariela Heschen. She is the medical director of breast imaging for RadNet Imaging Center based at Los Coyotes Imaging and Women's Center in Long Beach. And, we're talking about mammograms, especially during COVID-19. Might seem like a different kind of way to have to handle it, but you know what? Basically, it's your health and you can't ignore it. In a moment, we'll continue. Thanks for listening to Tuned In.
Right now, we all feel a little disconnected. For seniors living alone, the isolation can be overwhelming. Connect with an older loved one and have the conversation of a lifetime at StoryCorpsConnect.org/AARP. A message from AARP, StoryCorps, and the Ad Council.
back to Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. We're spotlighting health this morning, and of course, the COVID-19 that is so prevalent everywhere in the world, and that can lead to some confusing ideas and thoughts. And to help clear the air a little bit this morning about one particular section of that is Dr. Mark Kerner. He's with Cal West Head and Neck Surgical Institute. He's based in Northridge. And we're going to talk about the differences right now between sinusitis and COVID-19 symptoms. And Doctor, good morning.
Good morning. Thank you for having me.
Thank you for being with us. You know, and I've heard this from a few people who have had what they consider to be, quote, the common cold. And, you know, of course, because of the heightened sensitivities to COVID-19, people sometimes think, well, maybe I have COVID-19. What's the big difference between having a normal sinus problem versus having COVID-19?
Sure, very good question. So the coronavirus, the novel coronavirus that's causing the COVID-19 disease, is actually a cousin to the coronaviruses that cause the common cold. So there is some overlap with the symptoms, and some of those symptoms can also be seen in sinus disease as well. So classically, we've been talking about the COVID or coronavirus infections as causing fevers, cough, and sometimes shortness of breath. But we now know there's a lot of people that have had it only with some minimal symptoms, including loss of smell and loss of taste, and that can be seen in sinus problems as well. So typically with sinus problems, we'll have congestion, postnasal drip, a runny nose, maybe some facial pain or pressure, symptoms that are not typically associated with the coronavirus infections.
You know, and when the concern that, of course, has become so heightened because of COVID-19, people, of course, want to make sure they're doing the right thing. I think fundamentally where you begin with is if you're not sure, you have to get yourself checked out, don't you?
Right. And now we've got pretty widespread testing available to everyone. So if you really thought you had those symptoms, and again, those symptoms would be primarily a cough or a low-grade fever. Now, only about 50% of the people with COVID have really had fevers, but obviously fever is one of the symptoms and one of the traditional symptoms, or an acute loss of smell or taste that's not associated with anything else. Then I would suggest somebody get tested. Now, if you're just having a typical seasonal runny nose, some congestion, some itchy eyes, you don't necessarily need to be tested for COVID because it's still going to be highly unlikely that you had it.
Making sure that you know your body, of course, is paramount with any illness, of course. When you see patients that come in to see you and have concerns, do they seem to have more of a mindset that I have to have COVID-19 because of all the press that's being generated about it?
Well, there's clearly a number of people out there that we're seeing and on a regular basis that are concerned and think they've had it. Either they had a pretty severe upper respiratory infection or a flu-like illness this year, and we're pretty sure they had it. And we've been antibody testing, and we're also nasopharyngeal testing patients too. And we're actually finding a relatively low rate of people with antibodies. So, and some of those that we've tested that have been positive have actually been completely asymptomatic. So they never even knew that they had an illness or, you know, that would be suggestive of this. So, but most people who have allergies have had them for a number of years, and they do know the symptoms. And so, at least in our patient population, you know, they know when it comes on, they know it's the typical seasonal, you know, allergy-type symptoms, which is the congestion, runny nose, postnasal drip, itchy eye kind of symptoms. And, you know, whether they're a little bit better or a little bit worse, that's something that we're certainly seeing a lot of right now.
It's Dr. Mark Kerner of Cal West Head and Neck Surgical Institute. He's based in Northridge. This is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated, and we are discussing this morning health-related issues, and specifically here with Dr. Kerner, the comparisons between COVID-19 and sinusitis. Doctor, just to get away from COVID for a moment here, sinusitis has been in such a thing with so many people for so long. Have you seen the whole sinus issues that have been in the world getting worse as time goes on, or are they sort of plateaued?
Well, I think, you know, we are seeing sort of a slowly rising incidence of sinus infections, and I think a lot of that's environmental. So whether it's chemical irritation, allergy types, you know, allergies that lead to prolonged recurrent sinus infections, anatomic issues. So there's a whole myriad of reasons have sinus infections, but we think a lot of the fact that we're seeing sort of a rising incidence is related to environmental issues. So people are allergic, they either have chemical sensitivities. You know, we used to see a lot of that when there was a lot of smog in the air. That's actually gotten a little bit better.
Right.
You know, but we still have, you know, those kind of irritants. And those things, what they lead to is they lead to swelling, and then they lead to blockage of the small passages that our sinuses drain through that get into our nose. So it doesn't take much swelling and much irritation to cause blockage in any of those sinuses. And when you get the blockage, that's when you end up with the infections. And then the subsequent symptoms, which is that facial pain and pressure, congestion, postnasal drip, you know, runny nose, you blow your nose, and you've got purulent drainage. So that's the typical pattern of a sinus infection. So we use antibiotics to help clear that infection. We're big fans of nasal irrigation and nasal flushing because that then helps our sinuses, the sinus mucosal layers, clear themselves and helps clear those small sinus openings. And then we use things like nasal steroid sprays, which are now over the counter, like Flonase, fluticasone, which also cause a reduction in that swelling, which helps those sinuses drain.
You know, I remember when I was a kid, there was a thing called a neti pot, which would be used by generally older members of my family. Is that still relevant today, or is that sort of yesterday's technology?
No, absolutely. I mean, it's still a valid way to irrigate your nose. You just have to turn your head and then sort of allow that to come in, you know, sort of flush it in one side, let it go out the other. I like to have our patients use the bulbs or the bottle sort of irrigators. I think they're a little bit easier, a little less messy. There's now some other commercial devices on the market, which I have no financial interest in, but like the Navage, a little bit more expensive device that actually has a suction attached to it, so as it's flushing, it also suctions that out, so it makes it a little bit more comfortable. So you can either use one of those devices. Some people use a water pick on some gentle settings, and there's some nasal irrigator tips for that as well. So there's all kinds of devices out there. An neti pot is just one of those original old-fashioned devices, and it still works quite well.
Dr. Mark Kerner is my guest. He's with Cal West Head and Neck Institute in Northridge. This is Tuned In for Mount Wilson FM Broadcasters and Global Jazz Incorporated. We are talking about your health this morning here on Tuned In. Dr. Kerner, you know, as we talk about the COVID-19 and the prevalence that it has, of course, come into our society here in 2020, when you think about all the patients that you've seen come through here in the last few months,